Millions battle dangerous levels of cholesterol. The American Heart Association is now pushing for more personalized risk assessments.
These new guidelines just released, paired up with a new cholesterol-lowering drug option for people at the highest risk for cardiovascular disease. Farah Jadrin's in the studio now with more. So Farah, how can people start following these new guidelines?
Well, Dan, Jennifer, these recommendations are actually reinforcing some of the other recommendations made a few years ago. They include healthy living, lifestyle modification, and prevention, things you can start doing now. Having high blood cholesterol raises the risk for heart disease, the leading cause of death, and for stroke, the fifth leading cause of death. With nearly 1 in 3 Americans living with high cholesterol, the push for these guidelines to stick is paramount. Among the guidelines, continuing to use the risk calculator remains the top tool to identify a patient's 10-year risk for cardiovascular disease. Checking risks tied to family history and ethnicity, as well as certain health conditions, may also change a person's treatment plan. For some, this may require a coronary artery calcium test, or CAC. As for cholesterol-lowering drugs, the approach may be different for those with higher overall risks and patients in need of prevention due to genetic conditions that cause high cholesterol. Now, when high cholesterol is identified in children, they could also make an alert to their doctor to have other family members who may not realize they have high cholesterol, so they can be tested as well. While children may not need medication, getting them started on healthy behaviors earlier on will help them down the road and make a difference. Jennifer?
All right, Farah, thanks so much. And of course, you can stay here with News Channel 9 for Good Morning America, which starts at 7 a.m. Dr. Jennifer Ashton will be on live there to discuss the new guidelines.